This presentation is about tobacco, risks of use, and cancer, created by the Community Outreach and Engagement Program from the Columbia University Herbert Irving Comprehensive Cancer Center. Today we will learn about tobacco, different types of tobacco products like smoked, smokeless, dissolvables, and vape. We will learn what is in tobacco products, what harm can tobacco products do to your body, and where to get help to quit smoking. What is tobacco? Tobacco is a plant grown for its leaves, which are dried and fermented before being put into tobacco products. Tobacco contains nicotine, an ingredient that can lead to addiction, which is why so many people who use tobacco find it difficult to quit. These are examples of smoked tobacco products. There are cigarettes, cigars and cigarillos, pipes, beedies, Kreatex, and hookah. What is in a cigarette? There are approximately 600 ingredients in cigarettes. When burned, cigarettes create more than 7,000 chemicals. At least 69 of these chemicals are known to cause cancer, and many are toxic. Many of these chemicals are also found in consumer products, but these products have warning labels, such as rat poison packaging. While the public is warned about the danger of the poisons in these products, there is no such warning for the toxins in tobacco smoke. What does smoking do to your body? Smoking can cause 16 different types of cancers in your body, including cancer of the lung, stomach, liver, esophagus, and so forth. It can also lead to many chronic diseases, as you see listed here, like stroke, blindness, tuberculosis, diabetes, pneumonia, coronary heart disease, and more. What does smoking do to your lungs? Smokers' lungs are black. The black color is because every time you inhale a cigarette, it deposits tar in your lungs. Over time, and after smoking lots of cigarettes every day, enough tar deposits build up inside the bronchioles until it is distributed throughout the entire lungs. Cigarette smoke contains many chemicals that harm your respiratory system. Your respiratory system is a system that you use to breathe. These chemicals inflame the lungs and can lead to the overproduction of mucus. Because of this, smokers are at an increased risk for smoker's cough, bronchitis, and infectious diseases such as pneumonia. Now we are going to learn about secondhand smoke. Secondhand smoke is smoke inhaled involuntarily from tobacco being smoked by others. Many health problems in infants and children are caused by secondhand smoke, including wheezing and coughing, asthma attacks, and ear infections. Some health conditions in adults can include coronary heart disease, stroke, and lung cancer. Smoking during pregnancy increases the risk of health problems for developing babies, including preterm birth, low birth weight, and birth defects of the mouth and lip. Nicotine is a health danger for pregnant women and developing babies and can damage a developing baby's brain and lungs. This water pipe is called a hookah. Hookah is also known as a nargile, shisha, or goza. The hookah pipe tobacco has the same chemicals and is as unsafe as cigarettes. The water in the hookah does not filter out the toxic ingredients in the tobacco smoke. Smoking a hookah is the equivalent of smoking 100 cigarettes because one session of hookah pipe smoking lasts about 45 minutes to an hour, while a cigarette lasts just a few minutes. During that time, hookah users may breathe in as much smoke as a cigarette smoker would from 100 or more cigarettes. Why is hookah use dangerous? Hookah smoking increases the risk for men and women of, among other things, decreased fertility, also herpes, hepatitis, and tuberculosis from sharing the same mouthpiece. It can also affect babies born to women who smoke hookah. They are more likely to have a low birth weight and breathing problems. What are e-cigarettes? E-cigarettes are electronic devices that heat a liquid and produce a vapor or a mist of small particles in the air. They can come in many shapes and sizes. Most have a battery, a heating element, and a place to hold liquid. Using an e-cigarette is sometimes called vaping. Some e-cigarettes look like regular cigarettes, cigars, or pipes. Some look like USB flash drives, pens, and other everyday items. What is in e-cigarette vapor? Well, e-cigarette vapor is not harmless water vapor. It is difficult for consumers to know what e-cigarette products contain. For example, some e-cigarettes marketed as containing 0% nicotine have been found to contain nicotine. There are many risks of vaping, including nicotine addiction, mouth and throat irritation, coughing and wheezing, worsening asthma, chest pain, raised blood pressure and heart rate, upset stomach, including nausea. E-cigarettes can harm children. Nicotine can harm the developing adolescent brain. The brain keeps developing until about age 25. Using nicotine in adolescence can harm the parts of the brain that control attention, learning, mood, and impulse control. Using nicotine in adolescence may also increase the risk for future addiction to other drugs. The use of e-cigarettes is unsafe for kids, teens, and young adults. Smokeless tobacco is tobacco that is not burned. It is also known as chewing tobacco, oral tobacco, spit or spitting tobacco, dip, chew, and snuff, which is inhaled. Most people chew or suck the dip, for example, in their mouth and spit out the tobacco juices that build up, although spitless, smokeless tobacco has also been developed. Nicotine in the tobacco is absorbed through the lining of the mouth. Smokeless tobacco products that dissolve or melt in your mouth are orbs or pellets that look very much like chewing gum, sticks that you can suck on, and strips that melt in your mouth. These are some examples. What is in a smokeless tobacco product? Smokeless tobacco products typically contain over 3,000 different parts, many of them chemicals. All smokeless tobacco products contain nicotine and therefore are highly addictive. The health risks of smokeless tobacco include oral cancers, like cancer of the mouth, throat, cheek, gum, lips, or tongue, dental problems like cavities, staining of your teeth, and gum disease, cancer of the pancreas, and cancer of the esophagus. Holding smokeless tobacco in your mouth for 30 minutes gives you as much nicotine as smoking 3 cigarettes. What are the benefits of quitting? At 20 minutes, heart rate and blood pressure drops. At 12 hours, the carbon monoxide level in your blood drops back to normal. Over the first year, your sense of taste and smell return. At 1 to 9 months, coughing and shortness of breath decrease due to better lung function. At 2 to 5 years, stroke risk can fall to that of a non-smoker. And at 10 years, the risk of dying from lung cancer is half of that of an active smoker. What will tobacco treatment programs do for you? They can give you treatment options that work for you, help you to choose the best treatments, give you ongoing support and motivation that you need to quit. They can answer your questions, and they can help you to avoid starting smoking again. The following information is for the tobacco treatment program at New York Presbyterian Hospital. The telephone number there is 646-317-QUIT or 7848. You can also contact Dr. Annie Eusebio, who is a tobacco treatment nurse practitioner. Her number is 646-599-6740. Her email address is aeusebio@nyp.org. You can quit smoking. Thank you for listening today. Please feel free to take down our contact information and also feel free to contact us whenever you would like. Thank you. Have a great day.